Hey, what's up? It's Aaron. Welcome back to the show. Today, I'm going to answer a couple questions. And I've had some really great questions in one of our private groups, actually a couple of our private groups. And I just wanted to share those with you because they're slightly different, but also I think important things to know. And a couple things I haven't chatted about on the podcast yet. I've already answered them in our groups, and I'll expand a little bit on the answers, but I wanted to share these with you because I think they're important. A couple things is, one, it's the beginning of the year in 2025, and there is plenty of opportunity out there for you to grow and grow your cash practice, grow your in-network business, grow whatever business you have. It's there. The new year's here. People are ready to buy. People are working out. There's a lot of opportunity, so don't stop and think that the time has passed you by. It's still in front of you. So I want to share that with you. And then the other thing I want to share before I get into the kind of the Q&A is more, I've had a lot of people messaging me lately telling me they're undecided or they're not really sure. And I almost need to make a separate episode on this, but it's like, are you undecided? I think what you're really undecided about is that you want to work hard for a business, because opening businesses is really proven. A physical therapy clinic, occupational therapy clinic, those things, there's thousands of people doing it, even doing it cash based. It's, do you want to work hard enough to make it work for you? And if the answer is yes, then this is the right place. And if you're like, it's definitely no, like you're probably not here anyways. If you're still thinking about it, hopefully just the answers to some of these questions will show you that the answers out there, they exist, the solutions exist. You just have to be willing to look for them and willing to try some new things. So that being said, I just want to kind of go through a couple of these questions because I think they're super valuable. This one's from Spencer. Spencer's a member of our Cash PT Blueprint case study program. And he said, had a few people asking about using HSA to pay for therapy. I'm not sure what credentials are needed to accept that. I've seen some systems allow you to charge their card. Another route was submitting Superbills to HSA Direct. Any ideas on how to maneuver the system? Basically, all you really need to do is tell your credit card processor that you are a healthcare business. So when you sign up, like when you get a Stripe account, or maybe you get a Square account or Card Connect or something, there should be a checkbox that says you're a healthcare provider. And if you can check that, it should work. If someone comes in and they use their HSA to pay for HSA card or FSA, their flex spending card, to pay for your services, and it doesn't work, it's because the merchant processor probably is looking at you as like a retail or some other service provider. And so you just need to make a call to get it. In order to accept HSA and FSA cards, remember, part of it is it's not your responsibility to determine their plan, what their plan is going to pay for. You know, let's say it's massage therapy. Their plan will determine later that, hey, that's not a covered expense. And so then the person just has to pay like the tax on that income. It's your responsibility to care for the patient. How they pay is how they pay. And what you can do is you give the patient a Superbill, but you don't need to send the Superbill to the HSA account. That is something for the patient to send to them at the end of the year if that's something that the insurance company or HSA wants. So you can easily get this set up with Stripe. So what I said to Spencer was set it up with Stripe, and when you create an account, and then you can use that, you can bill people directly in Stripe or wherever, or you can integrate it into PT Marketing Machine. In PT Marketing Machine, you integrate Stripe and you can set up little checkout pages, or you can just, charge people for physical therapy, or you can put it in there as a charge for their package or program, etc. You can integrate Stripe with a lot of things. I think there's other payment processors you can integrate into PT Marketing Machine. This is the easiest and most direct one. But it's fairly simple. You take their HSA card, FSA, they work a little differently. Patient's responsibility to deal with the back end. You can give them a Superbill if they request it. Super simple and easy. And one of the cool things that you can do with payment processing, if you're using the right, something like PT Marketing Machine, is you can set someone up on an auto bill. So when they belong to your like Wellness Warrior Club, your membership, it can be just $250 a month, and it just auto bills them. Or let's say you put them on a 16-week payment plan for $2,000, whatever 2,000 divided by 16 is, you can already have that predetermined in there, and you just sign them up for that. And then they're paying, $150 for 16 weeks, and it auto bills them, and you don't have to ask them every week for the money. Thing is if something defaults or gets declined, you then have to go kind of chase it, but you can set up automated reminders and notifications in the system if a payment fails, which is really cool because sometimes you can do that and a card will fail and you're not getting any notifications or reminders. I know there's other systems I've used that when that happens, I don't really get a reminder that the card declined on a like a preset program. It just says card declined, and so I can't tell if it was an in-store decline or an auto bill decline. So anyways, that's what's really cool about using something like PT Marketing Machine for that. The next question is from Justin, who's also another member of our program. He said, I'm working on contacting different lead sources, a couple gyms in the area, a few direct primary care providers, like, cash pay MDs and physicians. What's the best way to frame the phone call in regards to a business partnership versus a referral source? Love this question. This is awesome. What's the best way to go about leading the conversation to ensuring they understand what you are asking or seeking? One of the ways to approach it is when you call is you say, hey, I'm going to be in your neighborhood tomorrow. Do you have 5 minutes to meet in person? If it's a medical provider, a physician who's busy and they're not going to answer the phone when you call their office. A lot of times I will stop by and be like, hey, I was in the area or I was upstairs seeing so-and-so. I thought I'd drop by. Is Dr. Smith available? Does Dr. Smith have 5 minutes to chat? I'm Dr. LeBauer. I was just upstairs. Does Dr. Smith have 5 minutes to chat? And they're like, yeah, he's right between patients. I'll go grab him or grab them or whatever. So that's one way to position it. What you want to do is you want to put a parameter around how much time you want, because they're like, I don't have 30 minutes to meet with you. It's like, hey, I'm here. Do you have 5 minutes to chat? Do you just have two? I'm just 2 minutes to chat and say hi. The other way to then do is once you get them in front of you or on the phone, whether it's a gym owner, physician, I don't know, someone selling widgets, you say, hey, do you have, I have patients who are always asking me about where to go work out, where to go for yoga, or who to go see, for their primary care, needs. I'm looking to learn more about your business and who you like to work with. When do you have time to chat? I'd like to get a vibe for the place so I can refer people to you. That's like one of the best ways to lead it, because what you're doing is you're entering this conversation basically saying, I'm not going to take a lot of your time, and I'm looking to send you some people. And they're, ooh. And if they're the type of person who's hungry for business, they will be like, yeah, let me make time for you. It's a really great way to do that. And then what you can do is you can always offer on the back end to, share resources with them. One of the great things that you want to be able to do, ask them like, hey, well, how do you think we should help each other? Like once you build some rapport, how do you think we can help each other? And sometimes they'll come up with great ideas. At times it's like, I don't know, what do you think? And you're like, well, I'd love to. I run these like back pain workshops. Would you be interested in us running one for your team or your members, your patients? Or I've got this resource on back pain and knee arthritis. Would you be willing to share this with your members or your patients? I'd be happy to print you out a bunch of copies or write you an email and send you a link that you can email out to everybody. Those are some great ways to do that. Here's another one. Yeah. So as she said, I'm looking for an app for home exercise program and fitness programming. I personally use Training Peaks with my adventure racing coach, and I like it for that purpose. So she's an adventure racer. Just wondering if anyone else has something else they really like. I'm going to provide a weekly schedule with workouts and a platform where clients can comment on how the workout went, etc. So here's kind of I think the number one thing here is to say, hey, is there when you're choosing a platform, there's probably 5 or 6 platforms that do the same thing. And it would be what feels good and is easy to use for you. Okay. It's not always about what that's more important than what does it look like for the clients. Because the clients aren't going to enroll just because of the way your app works. The app needs to be good. It needs to be a good user interface. But they're going to enroll with you through probably an in-person, a sales call, maybe even a sales page, somewhere completely different. And then the app is more of a delivery type of thing. It's why, same with my clinic, we were downtown. I had a clinic downtown when I first started, and no one went downtown Greensboro for much then, but that was where I could find a place that was relatively inexpensive, that was conveniently located, and decently safe, feeling. And downtown's better now, and I don't even have my practice in downtown, but people came there from far away, not because of the location and, what the building looked like, but they came because of what they were going to get. And so just keep that in mind. A few of our mastermind members and other people that I've coached have used Trainerize. I think there's another one besides Training Peaks that people use and they like. I've checked out Trainerize, and I think it's nice. One of the things, there's a couple apps out there that will allow you to kind of like white label the app. So when you're giving it to your clients, just like, hey, I want you to use my LeBauer physical therapy app, and they go download it. And so that costs an extra $100 or whatever, but that's really cool. Like, okay, great. Like this is your your app that they put up on the app marketplace that you can send to your clients. That's a cool feature. I mean, it's not make or break, but you can give it and you can personalize the app, and you can personalize different messages in there, manage your training programs, communication. I think the number one thing to look for is something that's easy for you so that you can interact with it. Because if you're not interacting with it, your clients aren't going to interact with it. Likely all of these, the top 3 or 4 different options are nice and proven that clients want to work in them. So I think it's more about what you want. And if the price variation is slightly different, don't really worry about the price too much. The price is the price. Like maybe you can get a better deal, but maybe one of them has a feature that is really important to you. There's not going to be the features everywhere. And I will say this, like if you're like, I'm not ready for an app, just use your Google Workspace account. You could use courses inside PT Marketing Machine, and then there's communities in there. And you can connect the course and the community inside PT Marketing Machine and put your clients in there and answer your questions and upload your weekly training plan for everybody, just depending on how you do it. And maybe there's a specific individualized plan you want, and then that person get that message directly. So there's other ways to do it. The best way to do it is the one that feels the easiest for you and is the fastest to execution. A question about forms. I'm working with Gwen. So Gwen Simons, I think she's been on the podcast a long time ago. Gwen is one of the lawyers and physical therapists who we refer clients to set up their consent forms and HIPAA and all that kind of stuff. So shout out to Gwen Simons. She's awesome. Rachel asked, the documents she provides are typical Word doc forms that you can print and have patients fill out. For telehealth, is Google Forms the best for legal paperwork, or is there another program for sending fillable PDFs? I've looked at DocuSign and IntakeQ, but not sure it's worth the price. So here's the thing, like Gwen or anybody is going to give you probably like a PDF or Word doc, etc. Most online intake form places, online, you recreate that form, or sometimes you can send them the form and they'll recreate it or give it to your VA. And it's really taking the paper document, and you can upload it somewhere like DocuSign and have it signed. IntakeQ, that's who I started using probably 8-9 years ago, and it was easy and simple. But is it worth the price? I mean, I'll tell you this. When I started using IntakeQ at $50, I think it was $50 a month, that was worth it to me because it saved me 2 or 3 hours a week because patients no longer had to come in a half hour early and sit there filling out the forms and spend 15 minutes of their appointment time filling out forms because they were just doing it super slow or they had a lot more. So is it worth the price? Yeah. But really, it's one of those things where it's like, is another software worth extra if something I have can do the same? And so I think this is where we got Rachel on PT Marketing Machine, because PT Marketing Machine now has the ability to do what is it called, like signed forms. And we can create the intake form that can be created in there as part of one of the pieces of the software that allows us to create what's it called, like a like a type form, a Survey Monkey type of thing. It's like where you go and you ask questions, like Google Forms. Like you can do Google Forms in Google Workspace. You can put it into PT Marketing Machine. The cool thing about putting it in PT Marketing Machine is it can automatically send the form to patients. They can read the consent and they can digitally sign it. And then once they do that, it can trigger the next email and step to move through the whole process and automate it. And it's really cool, and it's neat, and it doesn't cost any extra if you're already using PT Marketing Machine. However, I can say that no matter what you're using, saving that amount of time is worth the price. But I've actually moved, all of our mastermind members sign a platinum promise. And it's just really their expectations of us and our expectations of our clients, and an agreement for a term to work with, through. A 15-month term that, hey, if we're going to do X for your business, we should work at least this long and at least get your commitment. I used to use that on DocuSign, but I've actually recently moved it into my own PT Marketing Machine account because it's redundant for me to pay an extra $300 a year for DocuSign when it's already in something I'm paying for. So I've done that. That was a simple move and easy to set up. So you can do that with your new patient intake forms. Really simple and easy. And then it can be linked to the scheduling and linked to the follow-up emails and linked to the intake. And then you take some notes in Google Workspace or Google Drive or on paper or whatever other EMR you like to use. And so part of my answer to her was like, yeah, Gwen gives you these legal forms and consent and HIPAA and Medicare payment. Their intake and treatment note templates available. Like, so I've got my own intake and treatment note templates available in the Cash PT toolkit. So when you're a member of the Cash PT Blueprint, you get access to our toolkit with all the downloadable files and forms. And I've got these documentation forms in there. There's some on Word. There's some on Google, like not Google, Apple, like Pages or whatever it's called. But I've also got the Google Docs versions. That's my recommendation. They're super simple and easy. You can use something else for scheduling consent forms, but what we're recommending for all of our clients and our new clients is to use those features inside their PT Marketing Machine account, which isn't just for marketing. It's not just for sales pages or groups. It can also be used for basically 80% of your EMR, online intake forms, your scheduling. It can create Superbills and send them out to people. And then we just put the documentation in Google, like a Google Drive account that's HIPAA compliant. And so it really replaces DocuSign and can auto send forms and reminders for appointments along with all the marketing features. And it's really awesome. I mean, it's a super simple process and pretty much has everything you need. And I understand when people get in there, they start thinking about it. They're like, oh my God, it does too much. Let me just remind you, let's just take this public service announcement break and remind you, if you're listening to this podcast and you're a healthcare professional, you pass neuroanatomy. Technology, learning new technology is a whole lot easier than neuroanatomy. I almost failed neuroanatomy. It's a lot easier than remembering the spinothalamic tracts and where they go and where they move and all that stuff. I mean, so just take a deep breath and remember, when it comes to software, they all do more than you need. You only need one feature of the software to make it worth it. And if you only need one feature of the software, it doesn't mean you need to be paying less. It just means that feature is worth it and the other ones are bonus. And do I have multiple types of software that I'm using to run both of my businesses? Absolutely. There really isn't like one best all-in-one solution. There are better all-in-one solutions, or solutions that work for almost everything and do most things good. And some things you'll take you have to compromise on because it's convenient or less expensive, but nothing's going to be perfect. So this whole, I need to find one place that's perfect, or all the ones that are perfect, or if that feature's not perfect, it's not worth paying for, but this other one is making me money. Like, just get over the fact that it has to do everything. And because these last two questions are more software related, just get the thing that makes the most sense for you and use the one or two features that save you time or money, or make you money and give you more time, or both, and let the other ones do the work as well. Here's an interesting question from people who are completely cash pay and issue Superbills, I have a nuanced question. Is there ever a situation where your fees per code would be significantly higher and then you, quote, discount for self-pay rate? Would this ever be an advantage for a client seeking reimbursement from their insurance company? I had a client who had previously been seen by an in-network provider, and they were asking about how the other provider had these very high costs for codes and insurance paid a percentage. The client was obviously hoping to receive as much reimbursement as possible. I feel like this wouldn't change anything since insurance is only going to pay, if anything, a percentage of what the patient pays anyways. I told this patient that I wasn't able to do that, but I wanted to make sure that this really isn't something that happens. Basically, what she's saying is the patient came in and said, hey, I want to get the most reimbursement possible. Can you put on my bill a higher price than what you're actually charging me to make sure that I get reimbursed completely? Because my other physical therapy clinic I went to before did that. So basically, this patient had been to in-network PT and they saw either the EOB, the explanation of benefits, or their bill, and it said that the clinic probably billed $300 a unit, but they were willing to accept the $50 a unit that the insurance was going to pay, or something to that effect. And I'm now here as to my cash provider. Can you do the same? Because they're thinking it's like same, but that's not really how it works. So if you're in network, some people say you can't, some people say you can. I've seen this both ways, and I know providers that have done it because they've done it with me, is provide a same day cash rate. Maybe people have to sign a waiver that says, I don't want to use my insurance. I haven't really had to do that, but there's same day cash rate. So it's almost like a same day cash discount. And look, Blue Cross could have that discount too if they actually paid me the same day. There is technology to do that. You can do an instant wire transfers, instant, like authorizations, et cetera. They just choose not to do that. So that's not my recommendation, but that is possible. Okay. And that's what happens sometimes is you go somewhere and you either pay a cash rate or you see that the in-network provider is billing this high amount, but insurance is only paying a certain amount. And you're like, okay, well, this patient is like, well, I'm going to go cash. I want to make sure I get reimbursed everything. So can you basically inflate the prices? And I've had people ask like, well, can you just charge me $150 and not do it? It's the same as if someone comes in and let me make sure I get this right. Like they're getting a discount, right? So let's say I'm charging $100 a visit, but I'm giving the person a 20% discount, so $80. So really let's say I'm charged $200 a visit. I give them a 20% discount, and so it's $160 that they pay. When I give them a Superbill, I'm not going to give them a Superbill that says they paid $200 for the visit, but only charge them $160. Because now the patient is getting a Superbill that says they paid $200. That's fraud. The Superbill needs to say provider discount minus 20% that the patient only paid $160. So the patient is, paying $160 for the visit. It's like if you give someone let's say someone says, well, can I, if you got me down for 8 visits, can I just get all the Superbills ahead of time so I can submit to insurance? They can't do that either because they haven't received the care. So when a patient pays in full for their plan of care, we don't give them the Superbills ahead of time because I don't know what they've received. And so sometimes patients will ask for these things. And as a provider or even your front desk might be like, let me try to make the person happy and give them what they want, especially if the patient is like a former lawyer or something. Sometimes they're just very convincing. I've had this happen. And we don't want to commit fraud. So we can't give patients a Superbill for an amount that isn't what they actually paid us, which is basically what this patient was asking them to do. Like, hey, can you, charge me this so I can get that? And even if you said, okay, great, I'm going to put down that I charged $300 a visit and that you got a 30% discount. So you really only paid $200 a visit. If you put that on the receipt, then that's not fraud. You just need to just charge everyone $300 a visit. What the person wants to do is submit that they paid $300 to maximize their amount. And that's what it sounds like Sarah was asking her patient was asking her to do. So when we're doing it, Here's my answer to her in the group. I said, it's insurance-based clinics inflate their prices because you have to provide, they have to bill higher than than any insurance plan will reimburse them to maximize their payer mix. Otherwise, they're leaving money on the table, and that's the insurance game. They can give a same-day cash discount. Patients have asked us to give them a Superbill that shows that they paid more than they actually did, and that is fraud. In a cash practice, there really is no reason to inflate your prices and then charge less. What you want to do is make sure you're charging appropriate level of prices. And when you give patients a discount, you can put provider discount on there and show whatever it is, 5, 8, 10, 20% discount. I don't think you need to give more than the 10% discount, but sometimes a 20% discount is nice and an incentive to, take action. And then don't give a Superbill to people for a visit that they have not actually received. Maybe they've paid for it, but don't give one because you don't know if you're going to do all manual therapy or Therex. And what if the person doesn't come in, or they submit these Superbills and then they ask you for a refund because they didn't like you or something? Like, you can't really do that either. So hopefully that's clear. I think the main point is, and I've had patients do this, is that patients will sometimes try to coerce you or strong arm you or guilt you into doing something that feels like a benefit for them, but it doesn't feel right for you. I mean, I've even had patients come in and say, hey, I need to see your document, your intake, not your intake, your consent form. It's not right. Let me talk to your lawyer. I'm like, no. Just because they didn't understand something, they read it and, they're like, oh, I want to submit this to Medicare. I'm like, well, we're not a Medicare facility. And then we talked about that and they're like, oh, well, let me see. They're just, and this happened more in 2020 and 2021 than it has in the past. But over the last 15 years, I've had people do this where, because insurance is not a logical process, because health insurance isn't logical, because it feels like they're getting one over on us, we got to get one over on them. Sometimes patients will feel that and it's like, all right, they're trying to game the system because they know they're being gamed. So you just don't want to participate in that game on their behalf. Like, you can kind of do some things on their behalf, but you don't want to cross the line of giving them a bill or a Superbill or charging them an amount that isn't right, because you can still get busted. And I don't want to see that for anyone. And I definitely don't want to see it for myself. And so sometimes it's making sure that you understand this and understand what's right, and then making sure your team, as you grow and scale, your team also needs to understand. And it's really hard for healthcare providers to comprehend like all these nuances that insurance does. It's really harder for people who aren't in healthcare to do that. And that's where a lot of our patients are, and some of the team members at admin are. Like, they're not in healthcare, they haven't been in, and it's still hard for them to comprehend all the nuance of Medicare and insurance. And patients come in and they just try to basically steamroll. I've had patients try to steamroll my team because they want to be right. And it's a really tough thing to navigate. Hopefully those questions and the answers have helped in some way. There's always going to be a lot of other questions. They're going to come up randomly. There are going to be some common ones as you get started. And then there are going to be some more nuanced questions as you're growing and scaling your business. So there's really 3 ways I can help you right now. And so when you're ready, if you're just getting started building out a cash practice, make sure you get the Cash PT checklist. It's a 26 part checklist. I use this exact checklist when I launched my practice. I've updated it over the years, and thousands of people have got it now and use it to get their practice started. Go to cashptchecklist.com. You can always DM me the word checklist on Instagram. My auto bottle should send it to you. And that's if you're just getting started. And when you get the checklist, you'll also get an invitation to the latest free launch training. If you know you're starting, you're in the process of starting, you've already committed to starting your cash practice and you're working on it, or maybe you recently started and you're not yet seeing 5 or more patients a week. The best place for you is to be in our Cash PT Blueprint case study program. And this program is it's helpful for you once you've gotten started, but it's really designed to take you from the basics 0 to your first 5K in patients or more. 5K patients a month. So I've had a lot of people say, Aaron, well, I'm working on my website, or I just, already, and then I'm going to figure out how to get patients, or I'm working on, once I start getting patients in the door, then I'll enroll in your program. Like, this program's built for you so you don't make the mistakes along the way, and you can launch in the most effective way possible. And that sounds like something you're interested in or where you're at. You can go to cashptblueprint.com and check out all the details, or you can DM me on Instagram, the word case study, and I'll send you some details about how you can join our next case study group to launch your practice in the next 60 to 90 days, add another 5K in new patients to your business. If you already have a practice and you're looking for help scaling it, we've got a program. It's called our Cash PT Platinum Mastermind. This is for people doing 15, 20K months, and you want to scale to multiple practitioners, multiple locations. Just DM me the word private on Instagram. I'll send you some details. We'll hop on a call, brainstorm a plan, and we'll see if we're a good fit to work together. And then in between that, we've got our marketing program called PT Marketing Machine. And when you join our Cash PT Blueprint or Platinum Mastermind, you get a smoking deal on that. Very few people come to me to use that haven't been in those programs, but if that's you, just DM me on Instagram. We'll talk about it and see if it's the right fit for you. It does a lot and it's amazing, but it's not for everybody. So those are some of the ways that I can help. And then you can always just follow me on Instagram and ask me questions, or post in our Facebook group, Cash PT Nation, and check out the podcast, listen to YouTube, all the other free resources out there. Would love to get some feedback from you. What's helpful? What would you like to hear more about? I'm not counting that you'd send me that message, but I would love it if you'd send me a message on Instagram, or maybe leave us a 5-star rating and review on Apple Podcasts or Spotify, wherever you listen to this, because it always helps to know what you'd like to learn more about, so I can provide information and content that's going to benefit you. So let me know what you'd love to hear more about in the future, and I'll see you on the next show. Adios.